Hi guys, welcome to another dance show. I'm your host Mornay, bringing you the best in dive safety tips and so much more. Today we're going to be talking about headaches and diving, and Dr. Franz is back with us in the studio, and he'll give us some insights into that. So please kick back, relax and enjoy the show. Welcome, Dr. Franz.
Hi, Mornay.
So, headaches and diving, is this a big concern? I guess two parts here. Before the dive, if you have headaches, and I guess if you get a headache during the dive, those are kind of two things I can think of. But I guess, what are the major concerns, if any, about having headaches either before or during a dive? Is it safe to dive?
It's a very broad question. Headaches are common, and some headaches are serious. And in relation to prior to diving, some headaches may distract you while diving and therefore pose a safety hazard because of that. Or you may take medication for the headache, and the medication may impair your ability to dive safely. So there's some considerations prior to. Clearly, if your consciousness is affected for any reason, then that is a potential problem when diving. And whether it's the medication or the headache, that's a secondary issue. So that's the before or outside of diving. If a headache occurs during or shortly following a dive, then the question is really, is it something that you're doing that you shouldn't be doing, or is it an indication that you've been injured? Because headaches might be. So we could maybe explore it from both of those perspectives.
Sure.
And the first one would be to look at what are the common causes of diving-related headache. And one of the most common is actually a form of skip breathing. Now, some people deliberately try and conserve their compressed gas supply, either because they think it's the signature of a competent diver, or they don't want to sit on the boat because they become nauseous, so they try and be the last divers out. There are various motivations why people do it or try and limit their breathing. But the downside is that you build up carbon dioxide, and carbon dioxide opens blood vessels, which means that ultimately you get a bounding or throbbing headache. And that's very, very common, and therefore one of the first things we tell divers, if they've got what we call a vascular, so a throbbing headache after diving, is to make sure that they're not trying to conserve compressed gas. So they should breathe freely. One should not deliberately prevent yourself from breathing as you should. And also, if you find that you're starting to develop that sort of headache while diving, to deliberately take a couple of really, really deep breaths, and even to breathe out, not even through the exhaust port, but through the corner of your mouth, so that there's no resistance, that it really just bubbles out. Because a couple of breaths early on can abort the headache. Once you have it, it takes a while to deal with it. So I think that's the first one I'd like to mention.
Sure. So no skip breathing.
No skip breathing. And if you're getting a headache, make sure that you're not skip breathing, whether you're meant to or not. The second type is related to biting on your regulator mouthpiece. In other words, sort of really trying to keep it in your mouth, either because it doesn't fit very well, or because it's rather heavy, or because the mouthpiece just isn't designed very well for your particular mouth.
Well, I mean, sometimes you rent gear and the little mouthpiece is broken, so you have to really grip it with your teeth or lips or jaw, whatever.
And it should really be effortless. Ideally, it should hang from your teeth rather than be clamped between your jaws. And there are a variety of reasons why jaw clamping, if you like, would cause headaches. Some are related to your temporomandibular joint, TMJ related, which is typically associated with a headache sort of in this part of the head. Others may be related to clamping of the muscles and actually blocking the circulation because of the muscles being tense. Both would be uncomfortable, both would be sort of in this region, but the key issue is your mouthpiece the problem or not, and you should check. And the last one that I could probably mention here as something that you'd want to eliminate while diving is quite common when people have their cylinders relatively high in their BC to avoid them from slipping out. So they mount them high, the pillar valve is here, so they end up banging their head on the back, and the net result is that they sort of overarch and try and curl their head around the pillar valve to avoid that, or just because of the dive position that they hyperextend their neck. And that usually gives you a classic sort of tension headache here in the back of the neck, and that's quite common also. So those are three simple things that you can actually deal with. Avoid skip breathing, check your mouthpiece, and then make sure that your pillar valve or your body position doesn't require you to overextend.
And I mean, let's say you now have this kind of headache, or the three different types you've explained. How long would they last for? Is there no specific period that one can...
That's a very good question. I can't give absolute guidelines. It's rare for those sort of headaches to persist beyond 24 hours, but a tension headache can linger. You know, if the muscles have really been in spasm, that can last. If the TMJ has been inflamed, particularly if people also grind their teeth at night, it can be a chronic issue. So it may be aggravated by the mouthpiece, but it's something that they struggle with in general. Skip breathing usually recovers quite quickly, and also if one rehydrates, then that tends to also be alleviated somewhat.
Okay, so no more than a day roughly, I guess. If it's for more than that, then, you know, obviously...
Yes.
Some red flags or whatever the case might be.
And if it's atypical, it's better to call the Dan hotline rather than just drag it or ignore it. You know, rather get advice. It's rare for decompression illness to cause headache, but it obviously can. It's more likely with arterial gas embolization, but in that case there are probably going to be other symptoms like visual loss, etc., etc. And if people do suffer from migraine, they may be familiar with the sort of presentation that the migraine has. There are some concerns about diving with migraines or migraines, and it would be wise to just consult a DAN or diving physician if you do suffer from it, and particularly if you're taking medication to treat it. There are some considerations. It's not a no-go, so it's not an absolute contraindication, but it's something that one should think about.
Yeah, it was one of the questions, you know, so you have or you suffer from headaches, so now you have this problem and you want to go dive because, you know, you're hoping that diving will relax you and make you feel better, but if you suffer from chronic headaches, you're going to have some kind of medication, and that's then where the problem lies, I guess. You know, is it safe to dive with it? What will the effect of the medication be? And once again, you know, consult your doctor, I guess, or phone the hotline would be the best advice.
Yes, the principle we follow in general with diving fitness is the diving, the disease, and then the drug. So in other words, if the drug sedates you, it's a problem. If the disease distracts you or incapacitates you, it's a problem. And if the type of diving makes either of those worse, in other words, the condition worse or the drug side effects worse, then that becomes a problem. So that's a way in which we would approach it.
If you have headaches, it doesn't mean you can't dive. Just follow some general guidelines. If you get headaches during your dive, maybe just readjust, have a look what might be causing it. And again, I guess stay hydrated. It's always a good idea.
Absolutely.
Well, guys, that wraps it up for this show. I hope you're going to use these hints to your advantage when you're out diving at some stage. And keep a lookout. Give us a thumbs up on YouTube if you like it. We've got some show links with great articles yet again on headaches and diving. There's some great YouTube and audio podcasts also available. Or if you like, just give us a buzz at the office on 011 266 4900, or obviously on the website www.dansa.org. Thanks for watching. Until next time.
Cheers.
Cheers.